Hi guys, my name is Dr. Julio Perdave, chiropractor, athletic trainer from Miami, Florida. I'm here with one of my athletes, Mr. Derek Nadi, going to his 8th year and then to the NFL, 3-time Super Bowl winner with the Chiefs, but he's gonna play for the Jets this upcoming year. All right, so what we're gonna do is first is we're gonna do lower extremity adjustments, level 5 adjustments. We're gonna go hip, knee, tib fib, ankle, talocrural ankle, cuboid, and forefoot, and then the toes. We're also going to do a little bit of SI joint. We're going to do, at the lab, we're going to do an assessment, what to look for, some indications, contraindications for the adjustment of the joint we're going to do, and then practice it. Okay, so SI joint, hip, knee, tib fib, talocrural, cuboid, forefoot, and then phalanges. All right. The main thing to know is, just take them through the ranges of motion. Just make sure they're fully relaxed, they're in a comfortable position. Always check their history, make sure they're healthy. Make sure if there is some pain, then we're gonna treat it differently. But for the most part, this is what I do with my athletes prior to the game or practice. I used to make sure all the joints are moving well. But there is stuff, condition going on, then we gotta do further eval. Alrighty. So first, me as a therapist, I'm just feeling the restriction of circumduction here. And then there's a little bit here on the outside of the hip, I feel. Then I bring the leg down here, push down a little bit. Do you feel tightness in the front or in the back? Okay, good. So then you just make sure everything's normal, everything's moving good. All right, not bad. Ideally, the adjustments, loose back position. So learn the loose back positions of the lower extremity joints. For me, what we're gonna do is I'm gonna stabilize, get a hold of his ankle with my legs, get a hold of his femur, just make sure nice and easy, and then you should feel a nice little distraction manipulation there. Good. So got a little bit more range of motion. And of course, I'm gonna have different videos for the lab and more in depth. Okay. Next is the knee. Make sure the knee is good, nice and strong, the history is clean. What I check with the knee is medial external tibial rotation. Alrighty. Most athletes have external tibial restriction compared to internal. He also has a little tib fib restriction here. So let's do the knee first. Almost same position, get a hold of the malleoli. Now this time contact is in tibia, and then what I'm gonna do is we're looking into external rotation. I'm gonna do a little bit of distraction, and then external rotation. As far as the tib fib, I'm gonna show you in this view. Right in here, a little tib fib, get behind the head. And then you wanna do a little bit of internal rotation, and then just a little bit of knee flexion, and it'll go right. All right. Ankle. So, first what we need to do is we need to assess it, see what's going on. Normally I'll do a face down and face up, but we're gonna do supine for now. There is a little bit of restriction in here. Get a hold of the navicular and talus, and then the lateral hand, calcaneus. So the medial hand will be talus, and then what we're gonna do is he's going to, nice little distraction, stabilize distraction, make sure they're fully relaxed. Cuboid. Cuboid is right here. With this, wrap your middle finger on it, and then you're gonna wrap your, kind of cross your fingers over it, and then with that, it's a little distraction, and it'll go right up, right in. For forefoot, So the cuneiforms, metatarsals, yeah, it's a little bit of distraction and just a little translation. Nice and easy. Sometimes what I do, I get a hold of the digit and then a little bit of rotation and distraction. Do it for all 5. Perfect. Face down, please. Okay. All right, back to another way to adjust the tib fib. Get a hold here. Get a hold right here. You're gonna do a tissue slack laterally and then a little bit of knee flexion. All right, and then for the ankle, another way to adjust the ankle if it doesn't go supine is relax the leg. At this angle is fully relaxed. Get a hold of calcaneus, get a hold of the navicular talus, and then it moves. Also, what I check when they're in this position, I check for dorsiflexion, not palpating. Trying to feel with my hand that's right here in the talus. And I'm trying to see, am I feeling more compression or lack of dorsiflexion? And if it's because of the compression on the anterior side or tightness in the Achilles. Let's do this one. Yeah, this one's a little tighter. And sometimes you can't figure it out, just ask the athlete, ask the patient, do you feel more tightness in the front where my hand is or tightness in the back here? And there. Do you feel tightness in the back part of the ankle or the front where my hand is? The back, right? So some athletes will have tightness in the calves, Achilles, soleus Achilles, and that will prevent that dorsiflexion. Alrighty. I do feel a little restriction in the ankle too here in the front. So what we do now is get a hold of the calcaneus, the talus, and then a nice little distraction. Good. SI joints. First we check the leg length, see what's going on. Slightly high on the left. Check the SI, the PSISs, slightly high on the left. The ilium, slightly high on the left. So now we gotta see if it's muscle tightness, where the imbalance is coming from, so we could get the adjustment in. What I like to do is, I like to bend the knee here and stretch that hip flexor a little bit, see if there's any hike. Not bad. External rotation is great. Let's check here. This one hikes a little bit more. Okay, so it might be a little hip flexor tightness. Definitely a little bit of lateral hip tightness. Internal rotation is great. Last, we do a little hip extension to see where the tightness is. His hip extension is pretty good. Relax. Not bad. Alright, so his restricted side is this side, but for the video, we'll adjust this side. Do me a favor, on your side facing me, please. Bend the top knee, straighten the bottom leg. Relax it forward, yeah, right there. A little bit of rotation in the upper body. Relax, make sure they're fully relaxed when we do this. Make sure you have a low table. Make sure they're comfortable. See where it drops down. And then you're gonna hop on the lateral thigh, get close to them, a little rotation, lean back, and then good. Flat on your back, please. Awesome. Facing this way. top knee. Do it a little bit here. Great, cross your arms. Nice and easy, look over your shoulder. There you go. Good. Flatten your back, please. Alright. And that is the lower extremity adjustment.